Ukishapewa dawa, we need to be compliant with medication. Daktari amesema meza 5 days. Si by day 2 ninasikia vizuri. Ama hasikii mgonjwa. Nimeachana nayo. So you decide you've stopped. Nani amekwambia umepona? You know, just because you're feeling good does not mean that the ugonjwa, the infection that you had imepotea. Though I have come to the point of realization where judging patients and harshly telling them nani alikwambia uache, unajua hata utakufa sijui nini, that doesn't work, because what that does, it actually withdraws the patient further away from you. So we sit down and have a conversation. Okay, ma'am, unajua hufai kuacha dawa zako hivi, because ukiacha this and this can happen. So you have a conversation with your client or your patient, so they're able to understand what are the repercussions of them just abruptly stopping a medication without any form of purpose. So if you become compliant with medication, make sure you finish your dose. That's also one of the ways of reducing resistance, because you make sure the microbiome that ilikuwa, the bad mdudu, in short, that was found inside your system, imekuwa removed completely. Pill burden is a problem, I think, for everyone, to be honest. Even I do not like taking medication. The fewer, the better. So I know what we usually do at Case Wellness Center, we make sure as much as possible we reduce your pill burden, especially when we are following you through if you have a condition or you've been diagnosed with something or you've been going through something for a prolonged period of time. So we make sure you try as much as possible to be able to reduce your pill burden, because most of us are not able to take as many medications. Number 2, also many medications interfere with your kidneys, your liver, and your system. Now, on the other question of whether those pills are huge or they taste bitter, first of all, I want people to know the benefit of that medication vis-a-vis being bitter. Una imagine uko na malaria, umeamua umemeza 2 days, alafu nimeacha. Ati juu ninasikia, hii ni too much, sijui nini, hapana. Unfortunately, hiyo medication imetengenezwa hivyo na haina another outcome. So, what can you do? Especially for kids, because the bitter medication can make them vomit, which becomes redundant. So unaweza wekea kwa juice, maybe make a mango smoothie, so unamwambia atumie nayo kumeza. But most of the times unapata dawa za watoto ni syrup. You can be able to take the medication with something like juice, for example, because juice, at least something like a mango juice, you know, it's tasty, so itaweza kuiteremsha vizuri. Because unajua kama za malaria ni kali. But most of the times we recommend water. Juzi kuna mtu aliniambia, nilimprescribe ya magnesium. Kaniambia peremende ilikuwa kubwa sana karibu achoke. And I was like, okay. So what I explained to her was, usimeze zikiwa mingi at the same time. So maybe uko na 4 dawas that you're taking. Na umeweka zote kwa mkono, umezirusha kwa mdomo, umekunywa. Just take one at a time. That also eases your process of feeling ni kama hii dawa inaninyonga. You are allowed to crush, but believe you me, when you crush it, you'll now feel that bitter taste in your mouth. It becomes worse. And use foods that can sweeten it. So umemeza hiyo dawa ya malaria kunywa mango juice, ita mango. Kama umeze na uji ni mzito ita. You know, just to make it more palatable or easier to go down. But sasa kumbuka, kuna dawa zenye unafaa umeze before meals, after meals. So uliza pia, hii ni ya before, hii ni ya after. Ninaweza meza na kitu fulani? Yes, just to make it go down. Because point ni kumake sure dawa imeenda pia kwa system. Kuna dawa zenye hazifai kumezwa hata na maziwa ama chai, because they interfere with the absorption ya hiyo dawa. So that's why I said you need to ask. Ama mwenye anakuprescribe anafaa kuwa akijua na anakuambia. I don't know if you ever bought a dawa na unaambiwa na hii for this week usikuwa ukitumia chai ya maziwa. There's some medications you actually told that before you leave the pharmacy. So ask your healthcare worker. Na kama ajui, a pharmacist pharmtech usually knows, because they usually learn those things at school. So wale watu wanakanga kwa chemist, pharmacy, ama kwa hosi pale kwa wenye wanapeana dispense dawa.